Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
Hello everyone, my name is Aditi Gangal from Thip Media. Today we will be discussing vitiligo. Vitiligo is a skin disorder that is characterized by loss of pigmentation. A research has shown that vitiligo affects 0.5 to 2% of population worldwide. Another research paper shows that India has the highest prevalence of vitiligo in the world. Today, we have invited Dr. Swati Watwani to understand the basic aspects of vitiligo. Dr. Watwani is an experienced cosmetologist and aesthetic dermatologist who is a medical director and chief consultant at Persianlily in Maharashtra. We will be asking Dr. Watwani about what vitiligo is, its causes and symptoms, how the condition is diagnosed, its treatment, and other related questions. So let's get going without further ado. Welcome, Dr. Swati, to Thip Media's show Health Files. My first question to you is, what is vitiligo?
Okay. Hi, Aditi. First of all, thank you so much for having me for this very important topic, which actually needs to be highlighted. So vitiligo is a condition, a skin condition in which your skin loses its normal color. Now, why does your skin loses its normal color? Because it is triggered by an autoimmune response of the body in which your own immune system fails to recognize the pigment forming cells, which is called as the melanin pigment. And due to which, over the period of time, as this progresses, we see patches over the skin, which is called as depigmented areas. So this is basically vitiligo, and it is triggered by autoimmune responses, and hence it is also categorized as an autoimmune disease. So in common language, it is also just characterized by pale white big patches over the skin. Usually it starts with some affected areas and then it progresses to other parts of the body.
That's quite informative. My next question to you is, what are the symptoms of vitiligo?
So there are no as such any symptoms which the patient is going to come up with. It's the only symptom is that the patient is going to come up with these pale white patches. Sometimes it would be in segments, it would be irregular, or it would be scattered all over, but there are no any symptoms of vitiligo. It is just a very you can say cosmetic defect, and that is how it is characterized. There are no any physical symptoms. The patient is not going to come up with any itching, burning, or dryness of skin, or erythema, redness, nothing like that.
Okay.
Yeah.
My next question to you is, what are the causes of vitiligo?
So the most important cause is the altered immune response of the body, since we categorize it as an autoimmune this thing. The factors which actually trigger this autoimmune response are the pigment forming cells, which is melanocytes. Now what happens, as the response of the autoimmune response, our body fails to recognize these cells. And as it fails to recognize these cells, it treats these cells like a foreign body. Now, when it treats any foreign body according to the immunity which is being set up physiologically, it tends to destruct those cells. And eventually, what we see is the destruction of these melanocytes, and which turns out into pale yellow patches and then the white patches. Now, there are some factors which actually trigger the disease, out of which the one and the most is hereditary factor. So since a lot of genes are also responsible. The second is some environmental factors such as sunburn, mechanical traumas, or a certain inflammatory response to that particular area, which also triggers this vitiligo effect, and stressful events which have been continuously happening as a vitiligo patient goes through a lot of psychological impact, irrespective of whatever age he or she has been diagnosed. So these are some factors: environmental factors, psychological factors, stress factors, which trigger this disease. But as it is the autoimmune condition, the main factor is hereditary, genetic, which kind of predisposes it into active lesions of vitiligo.
Okay, ma'am, that's quite informative. Like, my next question to you is, how vitiligo is diagnosed?
So it's a most simplest way of diagnosing vitiligo. First is the clinical examination, and the clinical examination is you have to just, it is called as a Wood's lamp examination. It's a bedside examination done by a dermatologist in their clinic. There is a lamp under which you diagnose these lesions. These lesions in the early stage are, say, pale yellowish, then they turn into proper white, which is called as pre-vitiligo patches, and then they get converted into the chronic disease, which is the proper white vitiligo patches. So the best examination to do is to check under a Wood's lamp. Yeah, in certain case scenarios where multiple skin disease is involved, I mean, a patient is coming to you with multiple skin infestations already, then you can go for a skin biopsy to rule out if what is the differential diagnosis. That is the only required, but biopsy is usually not required if the patient comes to you only with white patches. If the patient is coming to you with pre-existing psoriasis, alopecia areata, and 3-4 combination of diseases, then always confirm your diagnosis with a skin biopsy.
Can vitiligo be cured completely, and how it is treated?
Unfortunately, vitiligo cannot be, I won't say cured completely, since it is a disease which has a back of a lot of genetic predisposition. It cannot be cured like, say, 100%, but the results of the advanced medications, the surgical options, and everything we go through, the patient gets a really good, wholesome results. But the tendency of recurrence is always there. So even if you say you get 98% results, there is always a susceptibility to recurrence again. So 100%, no, it cannot be cured 100%.
And how
as you
the
said,
condition is treated? Yeah.
So now the treatment part depends. There are different types of vitiligo. Then the differentiation of vitiligo depends on which area is affected, what is the body surface area is involved in the vitiligo, what is the type of vitiligo, how scattered it is, what is the age of the patient, what is the skin type of the patient. All these factors actually decide the treatment, because there are a lot of treatment modalities. But cutting it down short, so we bifurcate the treatment into two parts. One is the topical medications, in which we use topical corticosteroid creams or immunomodulator creams like calcineurin inhibitors and topical psoralins. If there are small patches, then if so they are big patches and there are the patches are scattered to multiple areas of your body, then you can consider oral steroids, pulse therapy, you can consider oral immunosuppressants, you can consider oral psoralins. So this is about the medication part. In children and in adults who have diabetes and other pre-existing comorbid, a lot of medications are contraindicated. You cannot give them immunosuppressants, you cannot give them a lot of steroids. So in that case, you can consider phototherapy. Phototherapy again can be done with narrowband UV therapy, and it can be also done with the help of excimer laser light therapy, which is the laser light given at the frequency of 308 nanometers. Then this is about the light therapies. Then coming to the surgical, now the first, the goal of any vitiligo treatment is to stabilize the progression of the disease. For example, if you have 10 lesions, you have to first halt the progress. You have to make sure that the disease activity is halted. Once the activity of the disease is halted completely, say the patient is coming and saying you that since 1 year, I did not have any new lesions, or the size of the lesion or the color of the lesion is the same. That means the progression of the disease is successfully halted with the help of the medications, the creams, everything you've given. In that case, to cover that depigmented area and to bring about repigmentation, you can go for surgical interventions like punch grafting, blister grafting. You can go for melanocyte grafting, all these options, or you can go for, as I said, plastic surgeries as well. You can consider all these options for the cosmetic camouflage. But after the progression of the disease is completely halted, there is no point in going for a surgery if the disease is still progressive. So these are different treatment modalities which we nowadays consider. But as I said, every patient is different and their treatment modality would be different. But it has to start with topical, then go to systemic, and then we can consider the light therapies coming to the surgical part.
Okay, ma'am. So the answer that you've just given is based on like the treatment that you've just told us is based on like Western medicine. My next question to
Correct.
you is, are there any home remedies that can cure, treat, or prevent vitiligo?
See, as I said, there are a lot of home remedies which have been, written down here and there in the books, but I would only come up with, say, those only which have clinical backup. So clinical trials have been done on ginkgo biloba, and ginkgo biloba is the only herb in which has supported in the clinical trials, and it has shows efficacious results in restoring the depigmented lesions, and it has also to some extent showed the halt of progression of the disease to a certain extent, not completely. So yes, ginkgo biloba extract and the combination of ginkgo biloba, you can say medications along with tinospora and all, these combinations are good which have clinical backup. Apart from just going for home remedies, there are some home safety measures also. Like whenever a lot of patients come to me and they ask me, tell me home remedies, tell me home remedies. Rather than that, in a vitiligo patient, I always go for advising them that rather than going for a lot of home remedies, go for home precautions. What you can do about your vitiligo at home? You can take vitamin D supplements. You can have sun exposure. Be very, very imperative about using sunscreen. Make sure you apply, because vitiligo skin is very sensitive and it will burn easily. It will get damaged easily by the sun when exposed for a longer period of time. Avoid going in the sun from 10 to 4. Use a SPF 50 sunscreen. Make sure you're using physical block if you're going for sports, swimming, sauna, or anything like that. So I think these home remedies use a scarf, hat if you're going out in sun. Avoid exposure in peak sun hours. So these are the home remedies, or these are the precautions which you can advise to the patient, which is much more important than just sticking to home remedies, as there are very few home remedies. But then again, as I said, anything, as we previously discussed, can trigger the vitiligo as well. So anything which is causing your skin a secondary trauma will trigger your vitiligo again. So better to be more, prevention is better than cure, is what I would go for, is what I advise to my patients.
Okay, ma'am. Ma'am, my next question is, like you've just informed that vitiligo is a genetic disease. So like, at what age vitiligo can start? Like how soon a person should visit a doctor, like in case if vitiligo runs in a family?
So vitiligo can start from any age. There are studies, there are reports, and there are cases which have been notified right from the birth of the right from the childbirth to up till 81 years of age. Also, vitiligo cases have been reported. But the most common incidences of vitiligo vulgaris or the rapid progression of the disease is usually seen in the second to fourth decade of life.
So my next question is, can we stop vitiligo from spreading?
Yeah, see, this is a very biggest myth about vitiligo. So first of all, vitiligo is not at all contagious. As I said, vitiligo is a disease which includes a combination of immunological factors, psychological factors, environmental factors, and inflammatory factors that is happening in your body, which is in turn causing vitiligo. It has nothing to do with any infection or any nothing. It is absolutely non-contagious. You do not get it from someone's touching someone or sharing someone food or sharing someone's clothes or linens or anything like that. It is not at all contagious.